Hi everyone, my name is Julia. I'm a birth doula, and today I'm going to be talking about due dates. Your due date is calculated by something called the Nagel's rule, which takes the first day of your last menstrual cycle and adds 280 days or 40 weeks to it, and then you get your due date. This is based on a 28-day cycle where you ovulate on day 14. Now, most women do not have a 28-day cycle or ovulate on day 14. There is a ton of wiggle room in this time. You could have a 25-day cycle. You can ovulate on day 5. You can have a 34-day cycle and ovulate on day 17. There is so much variation on what normal is. When we think about due dates and a lot of the controversy that surrounds them, it's because of this. It's because women don't fall in this cookie cutter way. Normal is anywhere between 37 and 42 weeks. Some babies need longer. Some women need a shorter amount of time. Everyone is so different. Again, so many different variations of normal. A fun stat that I really like is that only 4% of babies are actually born on their due date, and most first-time moms deliver around 41 weeks gestation. So take comfort in that. Barring any true medical concern, these last few days and weeks of pregnancy are vital to your baby and allowing them to thrive once they are born. You want to think about lung development, allowing them to mature their lungs so that they can breathe on their own. You want to think about the fat, all of the fat that they are putting on so that they can regulate their body temperature and stay at a nice homeostasis on the outside world. Thinking about brain development and all the crucial connectivity that's happening in their brain. These last few weeks allow for that. When you are, feeling bloated and sore and tired in these last few weeks of pregnancy, that is not a good enough reason to start poking and prodding and, start to intervene with nature's natural design. If you do hit your due date, I don't want you to start panicking, especially if your doctor starts talking about induction. Have a conversation with them, ask questions, ask why. Do you have a true medical concern or reason for induction? You want to think about hypertension, preeclampsia, gestational diabetes. You want to think about placental health. All of these things go into deciding if starting an induction is right for you. And sometimes they are. But just because you're tired and sick of being pregnant is probably not a good enough reason to start, that cascade of interventions. So in those final days and weeks, really leaning in to taking care of yourself physically, emotionally, mentally. Pregnancy, labor, and birth is, yes, the physical process of going through the motions of, growing your baby, laboring and birthing your baby, but it is that mental and emotional capacity. So if you've been using hypnobirthing or any relaxation tools, think about really relying on those in the final weeks of pregnancy, using your breath, slowing down, going on walks, allowing yourself to nest and really, surrender. When we're thinking about surrendering to the contractions in labor, you need to start thinking about surrendering to the end of pregnancy, regardless of how tired or bloated or uncomfortable you might feel. But also giving yourself grace in these last few days and weeks. Look how far you've come. You've been pregnant for 9, 10 months. Look at how far you've come. So remember that due dates are just an estimate. Every woman and every baby needs something different. There are so many different variations of normal. Hang in there. You've got this. You can do it. Thank you so much for watching. Bye.